Municipal workers sprayed disinfectant in a neighbourhood in Siliguri, one of many areas of the state of West Bengal under lockdown. From Srinagar in Indian-administered Kashmir in the north to Thiruvananthapuram in the south, around a third of India's 1.3 billion population are facing some lockdown restrictions. While some places such as Goa are only imposing a weekend lockdown, India's second most populous state, Bihar, has ordered its nearly 130 million residents to stay home for 2 weeks. Bihar is one of India's poorest states. Health experts are concerned about how rural and less developed areas are handling the outbreak.
Now as it spreads to increasingly in the rural majority states, the health infrastructure in the rural areas is far weaker, and testing, surveillance, contact tracing, etc. are going to be bigger challenges.
India is seeing around 35,000 new cases and 700 deaths every day. Even though it's testing more than 300,000 people daily, that's still one of the world's lowest. Experts believe the actual number of infections could be much higher.
It's almost certainly underestimated. And the question is, what is the level of underestimation that goes on? We feel that it might be underestimated by a factor, it's maybe even between something like 10 to 20. So when the number of cases altogether now, if it crosses 1 million, we're probably looking at something more like 20 to 30 million in the population, and maybe that number could be even larger.
Despite the rise in cases, the Indian government remains positive.
Health Minister Harsh Vardhan says India has performed better than any other country in fighting COVID-19, adding that only 2.5% of infections have resulted in deaths. But independent health experts say that number isn't accurate, not just because of India's low level of testing, but the fact that most deaths in the country aren't medically certified. Elizabeth Puranam, Al Jazeera, New Delhi.